Welcome, everybody, and thank you so much for spending your lunch hour with us. We're so excited to have you join us for this presentation, which we hope will be educational for you as you learn more about COVID-19 and senior living. Since we have such a condensed period of time, we want to make sure that we really jump into the meat of the matters as quickly as possible. We do have an expert panel of speakers who are assembled here today, and I'd like to take a moment to introduce you to them. Our speakers for the presentation today are Dr. John Hopkins. He is the president and founder of CCS Healthcare and is a huge asset to Vantage Point Retirement Living and our communities. He, along with his company practice, CCS Healthcare, provide physician services at our community in Limerick, Pennsylvania. That's called Arcadia at Limerick Point. But more than that, he's really been an integral person throughout the COVID-19 pandemic for a variety of communities and can really speak extremely well about the current state of COVID-19, not just in senior living, but in general. And I think he'll be a great person for us to kind of lead that discussion. And then we also have Rita Stevens, Vice President and co-founder of Vantage Point. She is the Vice President of Operations at the community. So her, along with her team of executive directors and community managers, have really lived the pandemic and safety protocols and procedures over the last year plus. So we're extremely grateful that she has a few minutes to share her time with us today. And then also Leland Marchione, he is our Regional Director of Facilities and has done an incredible job in instituting safety protocols, finding the best products that we can use within our communities, and has really come up with some creative and above and beyond tools, equipment, and procedures that we institute within our communities that help keep residents safe, both in their apartments and when enjoying the lifestyle that we offer. So they will be guiding us through a formal presentation, if that's what you want to call it. We want to keep things very collaborative today. But following the presentation, we will have a panel discussion with our regional directors, or our regional executive directors, Dave Bolton and Karen Garland. Dave serves as executive director at Meadowcrest at Middletown. He also served as executive director at the Lodge at Truett Homestead in Rehoboth Beach. And Karen Garland is our executive director at Arcadia at Limerick Point and serves in the regional capacity for our Pennsylvania portfolio of communities. I am Kate Sandler. I'm the Vice President of Sales and Marketing here at the company, and I support the communities in all of their incredible efforts. So I will be moderating our discussion a bit today. So the topics that we'll cover will be broken up into a few different parts. We will start our discussion with Dr. Hopkins covering the state of COVID-19 and senior living. Then Rita will discuss operations and address a few of the most frequently asked questions that we receive within our communities. Leland will be discussing kind of the physical plant, our safety protocols and procedures on the facilities end, as well as frequently asked questions. And then after that, I think the best part of the discussion will be a Q&A panel with everybody that I just introduced you to. So if you haven't already submitted questions, please feel free to drop them within the webinar. There should be a chat or a Q&A box below your screen. If you're following us on Facebook Live, you can just drop your questions in the comments. So feel free to do that for the duration of our hour together. And with that being said, I think we'll start with part one. Dr. Hopkins, I know COVID-19 has been constantly changing, and it might just be because of the spring weather and we're finally getting out of the winter, but it really feels like we're starting to come out on the other end of things. What are your thoughts on that?
Yeah, thanks, Kate. Thanks for having me. I think that was, feels like one of the longest winters we've ever experienced for sure. And, I really do think we are making progress and moving forward into a new dawn or new spring. I think that, several factors are contributing to the progress that we've made. And I'd like to just highlight those factors. If we could bring up the next slide, please. So there's a reason. COVID in the beginning was chaotic. COVID in the beginning was scary. There was a lot, just across the country, we were really trying to understand it as a medical community. Things don't usually move that fast. It's certainly it's been an experience for myself, for my practice, for my colleagues. The medical community has done a tremendous job in containing the virus and improving upon the devastation that we saw early on. And I think several of those factors, particularly in senior living, because that's my background. I spent a lot of time during the pandemic in senior living and trying to work through those problems. A couple of things to mention: testing now is widely available, whereas in the beginning of the pandemic, we had poor access to testing. Everybody was just figuring out, how do we test for COVID? And now, every senior living community has access to testing very readily. The infection control practices for COVID are much better understood. How is it transmitted? How do we contain that transmission? Is mask wearing effective? We know the answer to that is yes. Do we have to wear safety glasses? Can it be transmitted through your eyes and your conjunctiva? And we know that's true now as well. So much more insight into how the virus is transmitted than early on in the pandemic. Given that new insight, we can then educate the staff at the communities, and they're more informed, which just inherently is going to give you more effective infectious control strategies. And then social isolation effects, which weren't really thought about early on in the pandemic, are real, and they're much better understood. And senior living has done a tremendous job of trying to engage these at-risk elders who oftentimes were isolated for long periods of time, and the infection control strategies really reduce that isolation, which can have a negative effect. There's something called a monoclonal antibody that's now out there, and we've administered over 300 infusions of monoclonal antibodies, and it's reduced the death rate in at-risk seniors 75 and older by a factor of 5, from 20% down to less than 4%, which is absolutely tremendous. And then, because we have all this, we can start to institute visitation strategies in the senior living communities that allow the families to re-engage with their loved ones, and grandmoms and grandpops can see their grandkids again and see their son and daughter again. And finally, the biggest progress that we've made by far has been the arrival of the vaccines. And to say vaccines, for me, just gives me chills, because just the fact that we had one vaccine this far along in a pandemic, but to have multiple vaccines that are effective has just been a tremendous blessing and relief for the world. And all these factors, it's not just me saying that these have made progress. There's statistics to back it up. And on the next slide, I'm going to show you some of those statistics. So what you're looking at now is all of the senior living communities throughout the state of Pennsylvania. And it's from the beginning of the pandemic to the actual time of, about a couple weeks back. And what you're seeing is two peaks, right? You're seeing two peaks on the graph that show the amount of COVID positive residents residing in senior living. At the early part of the pandemic, you see a rise of, around April and May. That number was probably twice that size, but we didn't have testing available, so we didn't really know what the truth was. And then you see the second peak on the far right start to develop. And that's, around our dark November, December time period, where things were really getting bad and out of hand and scary, to the point where we didn't know what the other side was going to look like. But there's an inflection point on that peak, at the very top of that peak. And that's right around the time the vaccine started being distributed. And it's no coincidence that that caused the downward side of that peak to a point where COVID positive residents now in senior living it's almost not measurable. And the reason that is because the majority of senior living residents, rightly so, are opting to get the vaccine. Most cases of COVID positive seniors in senior living are coming from the community as move-ins. So it's pretty, I mean, it's a pretty compelling statement in that graph. And this data is readily available to anybody on the CDC website. Next slide, please. And then this is just a natural cause and effect of decreasing the number of cases. What did we experience death rate wise? Yes, we had a higher number of deaths in seniors because COVID-19 is much more deadly in the senior population, and that was a rightful cause for fear. But just as we saw two peaks in the testing and positivity rate, we see two peaks in the actual death rate in these communities. And right around the time of the vaccine on the far right, you see that stark decrease in the number of deaths. That's because infections have gone down. That's because we have more testing, and that's because we have treatments such as the monoclonal antibodies. So this is just so relieving to see. And if you see, it's almost down to zero at the April 8th mark, which is just tremendous. And some anecdotal stuff, I also run a monoclonal antibody treatment program sponsored by Penn State Hershey Medical Center to go to senior living communities and infuse monoclonal antibodies when outbreaks occur. And I'm happy to say our activity is pretty absent. It doesn't exist. In the beginning, we were getting called 5 days a week to come out. Now, if we treat one person a week with monoclonal antibody, that's a busy week for us. So it's been tremendous what the vaccine has done. Next slide, please. Now, if there is an outbreak, and that's a big if at this point, I mean, I think the number of outbreaks has tremendously decreased. Our ability to handle it has greatly improved. And that's because we have the rapid widespread testing within 24 hours. We know how to control the infection. The treatments are available, and the vaccination rate is near 100%. Next slide, please. And then I think the take-home message here is it's compelling and clear. I think we had two pandemics in the United States. You have your general public pandemic, and then you have your pandemic in senior living. And senior living took the brunt of the pandemic early on. But in my opinion, the pandemic is ending in senior living. The pandemic's still going on in the general populace, and we're still seeing spikes in cases. But senior living is well ahead of the general population on how to handle this because they were the most affected early on, or at least the most known affected. They were in a congregate care setting, and we had to react. And that reaction, that standing up of programs is bringing the pandemic to an end in senior living. And therefore, I mean, the conclusion is it's a safe housing option during the pandemic and beyond. There was a lot of fear about going into senior living. Now it's probably one of your safest places to be if you're an elder or older and trying to decide what where do you want to live. Because and that's for a couple different reasons. You have reduced variables. Your risk of exposure is lower because you have vaccinated staff and vaccinated folks that also live in the community. You have the access to the testing. You have your skilled staff. You have another big highlight is the strategies to combat social isolation during the pandemic. It's just so critical to have socialization to keep your cognitive function high. And then you have access to medical services, home health, and therapy. So, I think if I was going to recommend to somebody who might be isolated at home or be considering senior living at this point, and they asked me the question, is it safe or not? It's absolutely safe. And it's much more safe than we were in the past, and probably, like I said, more safe than it is in the general community.
Thank you for that, Dr. Hawkins. I think that was a really great overview, and that last slide I hope really resonated with a lot of people. when you move to a senior living community, anyone, I'm a little biased, and I think that we have really managed the pandemic extremely well. But when you move to a community that has managed things well, the community is all that you need, really. You have your restaurants, you have activities, you have residents and staff who the majority are vaccinated, and we'll touch on that later. But it's almost like a little bubble of everything that you need. And that's something that you don't get when you are living at home, either by yourself or even with your closest family members. So I hope that resonated by everybody who's watching that. Don't forget to ask questions as well. So if you'd like a little bit more clarity, or if there's a question that you think you'd like to ask Dr. Hopkins, please feel free to do it at any time during this presentation. Rita, as co-founder and vice president of operations, you and your team have dug your hands and rolled up your sleeves into all of the COVID-19 protocols and procedures. So thank you for sharing a little bit with us today. I think one of the most basic and burning questions that we get from anybody who's considering moving to senior living, again, of any kind, is how safe is your community? And I think that would be a great starting point for your discussion today. Rita, you need to unmute. I'm so sorry. So sorry.
There we go.
Sorry about that, Rita.
When you tell me not to touch anything, Kate, I don't touch anything.
I know.
I am the technically challenged person in the entire group. So I do listen when I'm told not to touch anything. But I want to first thank everybody for joining us today. I think this topic is really, really important today. And when you hear statistics from somebody in the healthcare field like Dr. Hopkins, who's been hands-on for many years and involved with senior care, it is important that we understand COVID, we understand the protocols, and we understand how not to be so afraid and what we're doing. And I think in all of our Vantage Point communities, even prior to COVID, we took our sanitation and our healthcare needs into such a deep perspective anytime there was any kind of an outbreak, because there's many viral outbreaks that can affect a senior community at any time, and they can be deadly, not perhaps as deadly as COVID, but still it's a factor that we need to take into consideration in senior housing every day. So we feel like, we in this industry and in our communities have been really, really prepared. So as we're stating that, right now with our communities, we have tried to follow all of the CDC guidelines, the state guidelines, and the local guidelines, and they all vary a little bit. We keep up to date on that on a daily basis. And the fact that almost 99% of our staff and the same percentage of our residents have been vaccinated has clearly been a benefit to our ability to socialize people and try to get into a state of normalcy. So our communities, when you first walk in the door, we have a system that we use. It's called AccuShield. And you walk up to the counter and you start the program, which asks you a number of questions about COVID, who you are, what you've been exposed to, if you've left the country, and things like that. And then it comes down to where you can actually be scanned, and it's an eye scan that takes your temperature. So within a minute or two, as you enter our community, you find out, what your temperature is, and if it's somebody's actively or you have a concern. I can tell you the other day, as I was entering our community and going through this process, as I was speaking to someone else as I was doing this, I actually hit the wrong button. And about 5 minutes later, my phone went off, and it was our director of nursing who called me and said, Rita, were you in contact with somebody with COVID? And I said, no, why? She said, well, you did answer yes to a question. So right away, there we are, she's calling me and apologizing. And I said, no, this is great. I mean, this is how this is supposed to work from the very concept of somebody walking in the door. So those are just some of the little ways right off the bat that we know. We are encourage everybody to get vaccinated. If you're vaccinated, it really does take our risk level down to a much more manageable level, and it offers a lot more freedom for our staff and for our visitation rights for people coming in. So it does give us a better level of comfort, but we are always at the same time following the mandated guidelines of wearing the correct and proper PPEs in the building, sanitation, hand washing. And I think above all of that, it really goes back to the basic principles of, really, again, hand washing. I can't say enough. My grandmother always talked about hand washing. It's something we should have been doing all along. Karen often says that too. How dirty were we before COVID came along? So this kind of brings all of those points back to the forefront. And I think our statistics on vaccination and where we stand today have really come a long way, and we're very excited about being able to open up visitation in our communities. In the higher levels of care in our communities go from independent living to assisted living to memory care. And above and beyond following all of those guidelines, really with the healthcare system as it's set today in personal care and memory care, you have to be a little bit more concerned than we are in our IL populations, because IL can come and go as they please. And then we have, as I stated, all of those other protocols set in place so that we can kind of contact trace and we know where they're at. But when it comes to families coming to visit, some of the best ways that we can provide for those visitation rights, for that one-on-one contact to come back again together, which, as Dr. Hopkins said, is something we've always known, but boy, was it brought to the forefront now with COVID that, when people are isolated in the elder community, it really affects so many other things. And we have to make sure we don't lose that contact. And that's what we try to do in our communities, is to kind of bridge that gap whenever and wherever we can. So, one of the important things is, and we can do, is the outdoor visitation, which, as the summer months are coming and things, it's going to be a lot more free and a lot more open, but we still have to manage all of those people who come into our communities. And that's whether it's a vendor coming in, whether it's another healthcare individual, a volunteer, or family members. I can't say it enough and often enough that a fully vaccinated population is really going to help bring back that feeling of home and care and one-on-one that we desire so much in our personal care and higher levels of care. We've all missed that. Our staff has missed that, and our residents have missed that, along with our families. Can my loved one leave without having to quarantine? Yes, in IL and independent living, they can. And again, we keep close track on who's coming, who's going, where they were. We did have one person recently that came back and had COVID. And boy, we didn't have to shut the building down. We followed all of the protocols, everything. We reacted quickly. They went out for the care. The other family member was taken care of, sanitized to our heart's content. And we have a great housekeeping and facilities team that really jumps to the occasion when anything like this arises, as well as the equipment that they have. And Leland will talk a lot more about that coming up next. But we were able to conquer that, and we did not have to quarantine everybody. We just closely contact traced and made sure we were following all the guidelines that were set for us. And that's what we're meant to do, and that's what we will always do. Next slide. Oh boy, communal activities and dining are probably some of the two most important things for our residents. And yes, in independent living, we have families coming in, sitting together at a table together, but we also make sure that we have the proper distancing protocols in place. People are wearing masks. All of our areas are sanitized after they're used, and we do see families coming together again, which is really quite a nice thing to experience. Now, again, it's a higher level of care, but in assisted living, we're hoping to do very much the same things. It's going to have to take its own time, but in time, we'll be able to gather back that whole family group again, and we miss that so much with our residents. And activities, what we'll do if we have a lot of people wanting to come to an activity, we'll just break it down into smaller groups, or we'll have it twice in the day, or we just find different ways. Our movies, we can't have 40 people in one movie room, so we might have the same movie shown 2 or 3 times a day or on different days. So there are ways to control this. There are ways to keep everybody engaged. And I'm so excited to see so many of our independent living residents who just came into our community back in January. And our first hands-on with them after not seeing them for a year or more gave us pause because, oh my goodness, some of them look like they really should have gone into personal care and not independent living. But I can't tell you the excitement we have to see those same people today that they've been with us for almost 3 months, and to see the change in them, in their attitude, how they walk, how they hold themselves. They're smiling all the time, laughing, gathering in small groups. And that is so different from the first and early days that they came in. So our communities are freeing up, and we intend to do everything we can to make that a reality each and every day. As Dr. Hopkins said, there is a light at the end of the tunnel, and it's coming with this spring and summer, hopefully.
Thanks, Rita. I think that that is a really good point to make, that I think everybody, but specifically seniors, have spent the last few months, or the last year. I can't believe it's been a year. Sometimes it feels like 2 months, sometimes it feels like 5 years, but it's been a little over a year, and they've spent a lot of that time really isolated. And that's something that I think, as Dr. Hopkins indicated, is the strongest kind of secondary effect and risk factor is being isolated at home. And it's nice to be able to open up our communities to activities and things like that. We actually have our community at Arcadia. Some of our residents are watching in the media room right now, so you just give them a good wave. So I hope you all are getting something from our conversation today, and thank you for enjoying it with us. Next up, I'd like to kind of tip things off to our Regional Director of Facilities, Leland Marchione. As I stated earlier, he's really created some incredible policies and done some good creative thinking in partnership with the corporate team and the community executive directors and managers to really ensure that our communities are among the safest, and that we're not just, of course, going along with CDC guidelines, but we're going above and beyond. That's something that's extremely important to us. So with that being said, Leland, I think you'll have a lot to offer on that topic.
Well, I hope so, Kate. Thanks for the intro. Hello, everyone. I'm happy to be here today, talk to you a little bit about our communities, what we've done to create a safer environment for you. As you can see on this first slide, our community was designed with infection control in mind. Each apartment is separate from one another when it comes to HVAC and ventilation. That means every resident has their own vent that brings in fresh air, and their own vent that takes that air back out. Each resident has their own filtration system, as well as heat and air conditioning. So there's no way for cross-contamination between you and your neighbor. You're completely separate. Now, out in the common areas, each apartment is separate from those areas. However, in the common area, it's a common area, right? So they have individual systems, but the areas are joined. So there is no way to segregate those areas, if you will. So in those areas, we have a higher level of air filtration in place. So we have what's called higher MERV rating on the filters on those units that pull the air in and put the air out. We have a MERV 11 rating on those filters. The next step up is a MERV 13, and that is hospital, doesn't get any more filtered than that. So, you know, that's someone that has immune deficiencies, stuff like that. The boy in the bubble, if you will. So, yeah, those areas are designed with you, the resident, and us staff members in mind. Staff, all of our maintenance staff are trained on best practices for maintaining these air filters, as well as cleaning and sanitation of the grill where the filter is located, and then sanitizing that ductwork that goes to the unit. So once a month, we clean those filters, replace those filters, but in that process, we are disinfecting with our electromagnetic or electrostatic sprayer, which I'll talk about a little bit more here in the future, but this is what it looks like. It looks like something from Star Trek, but we'll talk about that in detail in a little bit. So those areas are very, very well maintained and cleaned on a regular basis. If I could have the next slide, please. And to build on that, we talk about cleaning and sanitizing our community. We have a great maintenance and housekeeping staff here. Today, I'm here at Arcadia, and all of our staff here are trained on infection control. So this community is independent living, personal care, and memory care. Basically, what we've done is we've taken that higher level of cleaning and sanitization from our standard memory care, where people have a lower cognitive ability to, you know, sanitize and clean high touch areas, and transferred that throughout the whole community. So that gives us the ability to then clean more frequently. In those areas, we use a couple different products. All these products, mind you, are safe for you and they're safe for us. The goal here is to disinfect and do it safely so that we're not hurting anyone. So this product here is an Ecolab product, if everyone can see that. It's a hydrogen peroxide cleaner. This product has what we call a 30-second kill time. For those of you that aren't familiar with kill times, each product has a certain amount of time it requires to keep any surface moist or wet with the product to kill any given virus or bacteria in that. So this product has a 30-second kill time. So I can spray a surface down, let it sit for 30 seconds, and then wipe it off. And then COVID-19 and any other virus that's on there is now deceased. That surface is then safe for the next resident to utilize. We also use, as I said before, the electromagnetic sprayer or electrostatic sprayer. I keep saying magnetic, I apologize. Electrostatic sprayers actually energize the particles, the mist that it puts out, and it covers surfaces 360 degrees. So you're actually saturating a handrail. That handrail then front and back is misted, can stay moist or wet for the time it's required to disinfect that surface. In those units, we use this product. It's FSAN. And we also use it's called a vital oxide product. They're both hospital grade cleaners that, again, are safe for you and they're safe for me. They're also safe for all of our pets. They use them in veterinary hospitals and things like that. So this also has a 1 minute kill time, but it may have a longer kill time, but because we are doing larger areas, that's okay. These services, this puts out enough mist to keep those areas wet for that minute, if not more. So we use that electromagnetic sprayer in large areas. We also have, forgive me, we also have the Ghostbusters version, which I love. This is a 3-gallon battery powered sprayer. So it has this nifty little wand here. And if you're happen to be up in the middle of the night wandering around our communities, you might see one of our awesome concierge / security / maintenance guys or gals walking around with that on their back, spraying all the high touch areas, tables, handrails, intake grills for our HVAC systems in the common areas. So really cool stuff that is really only being utilized in a commercial aspect. So if you were to call a disinfection company and say, hey, I need my restaurant disinfected, they're going to come out and use this same equipment. We use it on a daily basis here at our communities. We also are utilizing nano septic strips, which is a pretty cool invention. They go on all our door handles in entryways. You can pretty much put them on anything. And basically they're almost look like a sticker that go on there. And they use an oxidation process to kill viruses and bacteria. So for those high touch areas, those things are great. You don't have to spray them with disinfectant or anything like that. They take care of it for you. Next slide, please. Well, Q&A panel.
You're done.
Well, that went better than I imagined it would.
You did an awesome job, Leland. For everybody that's watching, this is Leland's first event that he's done with us. You did an awesome job. Thank you so much, Lee.
You're welcome. There's a lot of information up here, and sometimes it's hard to articulate it.
Well, I have to say that I hereby volunteer to wear that Ghostbusters backpack at every event that we have from now on. So
awesome.
I will be the disinfecting lady because that just looks really cool. So
I'll get you set up.
Got to figure out how to bring show and tell along with me too.
Yeah. Rita's got to do a show and tell too. So yes, that concludes the presentation portion of our webinar. And I hope everybody did find that information helpful. We've received a few questions that have come in that 30 minutes or so that we've had. So we really want to reserve the last 15 minutes plus to go through some of those questions with you and give you the opportunity to really meet and discuss specific unique questions that you might have. So with that being said, we'll kind of open things up to our panel today. And we haven't had the chance to hear from Dave Bolton and Karen Garland yet. And I think one of the ways in which these questions really pertain to your answers, Dave and Karen, is Rita touched on it about how Pennsylvania and Delaware really differ in terms of they're fairly similar, but they do have kind of nuanced differences. So I thought we could spend some time going through the visitation and safety protocols that might be put in place in our Delaware communities that might differ for Pennsylvania, and also levels of care, what is being done in independent living versus personal care and memory care. So Dave, from a Delaware and independent living perspective, can you spend some time talking to us about that?
Sure, be happy to. As a matter of fact, some of the prior speakers touched on some of those components of our approach to safety and the appropriate precautions that we put in place to have safe visitation for our residents in independent living. And one of those protocols, our approach taps into the core principles of really COVID-19 infection prevention. So when visitors come into our independent living communities, they are screened initially, as was touched on before, and they are screened for signs and symptoms of COVID, i.e. temperature checks by a no-touch temperature thermometer, and questionnaire regarding observations about signs and symptoms. If individuals trigger on any of those questions or that temperature, then we address that, and they may be denied entry at that time until we clarify what their situation is. Standards of practice related to CDC guidelines as well as state guidelines surrounding hand hygiene, face coverings, and masks that need to be worn whenever a visitor and or a resident would be out of their apartment in common areas, and social distancing, maintaining social distancing requirements. All of those are in place and an expected practice to be maintained for safe visitation.
Karen?
Thank you, Dave. Thank you, Kate, and all of you. It's been interesting as we are opening different communities as to where it was last year to where it is this year. And with, Dr. Hopkins, who will be supporting our community and helping us manage this and individual issues, it's really been a learning for all of us. And everybody wanted it to go away in a day, and it's still here, but it is definitely moving in the right direction. To see the statistical analysis from Dr. Hopkins' screen about what vaccination has done is really exciting to know that the end can be if we work together. And I think that's the concept that we've approached here at the Vantage Point communities, that in education, in doing this right, every person has to own their part. From the receptionist, concierge coming in, sitting at the front, really, being comfortable with managing the visitation and the people coming in, and understanding that they're doing it to protect and keep people safe. For the most part, people are comfortable. They're doing it in a lot of other settings, so we don't seem odd in that way. To how quickly we respond to, technology is allowing us to communicate concerns so fast now. The fact that Rita got a call 5 minutes, it's because an alert came to my director of nursing and she did what she was supposed to do. Then as we look at visitation in the communities, which, as Rita explained, was so missing over the past year, we have taken the approach on IL that they live like they would if they were outside in the local community, but with our ability to manage their environment and to keep it safe with all the protocols of education of them, of their families.
Karen, I think you went on mute really quick. I'm sorry. We got a little technical bug. If everyone can unmute, there we go. I'm so sorry, everybody.
I don't know where. It's like a phone call. You don't know where the person last heard you. So
I probably pushed the wrong button. I'm sorry.
You touched something.
Sorry.
Basically, just recapping that every person in every part of the community has to know and do their job. And the philosophy has to be that we educate our staff members and the community and the residents that these protocols are in place to keep them well, and to allow us to move forward in what we can do as a community.
I think that's a really good point to make. And as you were talking, I was kind of thinking back to when the pandemic first started, how uncertain things were, and things were constantly changing. Do we wear masks? Do we not wear masks? What are we supposed to do? How are we going to contain this? What happens if there's an outbreak? And over the last several months, it's been really interesting to see like the senior living industry really take the initial fear and build off of it and learn from it. And I think that we have a confidence in our protocols and procedures that many other industries don't necessarily have, because our senior population is so vulnerable and susceptible to COVID-19. We don't have any other choice. And it's been nice to see this confidence evolve over the last year, and that knowing that we can take care of residents and keep residents safer here than they would be even at home. And that's something that we couldn't say a year ago, but we can confidently say now. So I think that's a really good point to make.
Absolutely. And I think Dr. John Hopkins explained when a pandemic started, you know, the knowledge base of how, what, where wasn't known to everybody. And some of the greatest medical scientist people of the world globally started to work together in unison. And then practices got put into place. One of the interesting things about senior living is we are mandated at stricter guidelines than the general public. So we had to follow those protocols. We had to report at a critical state every positive that comes our way. And then we had to see the cause and effect of what was causing it, how we contain it, and how we move forward. And those type of procedures and policies are now so well trained in everything we do that it is second nature now to us to say, oh, somebody got up from that table, let's wipe it down. Oh, this person has this, let's get them here. Oh, you can come, you can't come. It is, and now I think we're getting down to the point of where it's more individually based because of the herd immunity that is occurring in senior living by the majority of people getting vaccinated. It is allowing us to contain a smaller group of maybe unprotected people in a way that isn't affecting everybody. So I think senior living continues to lead in these areas, and other places should look at senior living. And the fact that you have a conglomerate of people working together to ensure safety is really kind of exciting. And it allows us to ask each other our experiences and learn from them. And I'm very happy to have Dr. Hopkins as a resource and a leading person in the senior living industry. His focus for us is truly our clientele, our residents, and our employees. And I think that's what is making us exceptional at this point.
Karen, I think you have some psychic abilities, because literally as you were talking about herd immunity, Kim and the rest of your family in the media room, who are socially distanced and safe, have questions about herd immunity. So they want to know, what does herd immunity mean, and are we there yet? So I think Dr. Hopkins is probably the best person to start that answer.
Sure. Yeah. No, absolutely. Herd immunity essentially means that enough people have been exposed to the disease and have been infected or have been vaccinated that it's very hard for the virus or whatever disease you're trying to be protected against. It's hard for it to transmit to somebody that's not been exposed. So the herd essentially boxes out the virus and doesn't allow it to get to the person that may not have been exposed or may not have been vaccinated. You know, infectious disease experts will say herd immunity occurs when we get either 60 to 70% of the population vaccinated or exposed. I think at this point, we're at 100 million people in the United States have received their first dose of the vaccine, which is not completely vaccinated. Out of 300 million people, that's only 1/3 of the population. So we're definitely not there yet in the general populace. But then when you look at senior living, as I tried to illustrate earlier, they're two different pandemics. Senior living is its own isolated entity, and their herd immunity most likely has been achieved at any community that's received the vaccination, given the rate of vaccination in seniors is above 95% of the population, if not 100% of the population for those who are eligible.
Now, what if one of our MeadowCrest family members posed this question, and that brings up a good point that kind of builds off of this, is if in the unlikely event that we haven't built up herd immunity and there is an outbreak, crossing my fingers while I say this, but if there is, can in communities where we have multiple levels of care, will we separate the independent living, assisted living, and memory care areas so that if something happens in one area, it's not negatively impacting the other levels of care?
Sure, I'd be glad to address that. There are different guidelines in place, and to Karen's point earlier, this is a constantly evolving situation. For example, in Delaware, when the initial state of emergency came out right around a year ago, from that point, we're now at the 9th modification to the 27th Amendment. I don't even know how many modifications there's been, but that just shows how quickly things are changing through this pandemic and approaches. So there are state and CDC guidelines, and we adhere to the most restrictive one if there is a conflict related to how we address what would be considered a positive or an exposure in one level of care, and how we would deal with that in terms of maintaining resident safety, quarantining approaches, contact tracing as well. So depending on the particular situation that occurred, that would trigger steps on our part to maintain a safe environment for our residents and visitors. And that can be as little as minimal restrictions being put in, or the individual possibly taking restrictions, to expanding that into other areas of the community, depending on the situation.
Yeah, I think there's a component to contact tracing in this instance, right, Dave? Because I'm constantly learning from you and Karen and Rita and Leland and Dr. Hopkins. But like you said, with these, how in-depth we've now been able to get with tracing, knowing who's participated in what activities and what staff member has been in what room. Our goal is to always create the least disturbance possible.
Correct.
Yes, ma'am.
One thing I want to add to that then also is that our communities that have multiple levels of care are physically separated in the building. So we don't have communal dining of everybody at once. Our independent living dining is set aside. We have another dining room set aside for personal care, and memory care has their own personal dining room. Also activities, it's the same thing. So we have a managed area, just in the building and the design of the buildings itself. And as Karen pointed out before, managing our visitors and who's coming back and forth, and contact tracing helps us to do that. So if we had an outbreak in memory care, quarantining them is a whole lot easier, and we don't have to necessarily quarantine the entire place. So that's how we can maintain that separate contact.
Well, and I think the idea of cohorting, cohorting is isolating different sections of the building to try and stop an outbreak. I think that's an evolving idea. That idea was important prior to vaccination. I would probably revisit that on a case-by-case basis to understand who's been vaccinated, right? CDC just released some data that shows that for those who have 77 million have been vaccinated, right? Out of 77 million vaccinations, only 5,800 of those folks had actually had a positive COVID infection thereafter. So that's 0.0008%, right? Or 1 in about 1,300. So there's a pretty good chance that even if you have one positive in the building and the building is all vaccinated, that you probably don't even need the cohort anymore. And those rules will change as we learn, but the risk is so low that I would actually be a proponent for a frequent testing, non-cohorting, to keep people engaged and to not isolate them.
That's a really good point.
And it's so great for those of us who are listening in. This is an example of how we work so well with an expert like Dr. Hopkins. When there's a suspected transmission, or when there was that single instance of the positive, we as a community are able to act immediately and consult with experts in the field, not just within the community and reporting it to corporate, but also consulting Dr. Hopkins as kind of our physician expert. And he's able to kind of give that result on what his recommendations are based on the information that he has to the day and oftentimes the hour. Because things are changing so much, it's just really great to be able to rely on that support too.
And I think it's important too for Dave to kind of bring up who we have in the background who will be supporting us at Meadowcrest and what we have at the lodge at Lewis.
Mm-hmm.
And
yeah, we have at the lodge at Truett, we have BB Healthcare that we've partnered with, and they are providing a wide array of services from therapy services to home health services and physician support services as well. And we're going to be partnering with a similar organization for the Meadowcrest community.
Leland, I saw you raise your hand. I'm not a teacher, so go ahead and talk.
No, it's fine. I just wanted to add to, the fact that each individual, like independent living is separate from PC and AL is separate from memory care. In that, like I said before, our community is designed with infection control in mind. So ventilation systems are segregated, everything's separate. So if in the event we did have an isolation situation, that resident could isolate in their apartment safely, without cross-contamination to other residents. So, with disinfection processes and all that stuff in place and all our infection control protocols, I think we have a good handle on managing that type of scenario.
Yeah. Now, even though I know we're right at the 1 o'clock time frame, but if there's a couple more questions that I have that I think are really important, if you asked a question and we weren't able to answer it, we will get back to you with that answer. We'll make sure that we're able to touch base with you. But all of the questions that we got were so great. But this one in particular is, what do you foresee for the future with the variants in senior living communities, even with those of us who have been previously vaccinated?
Yeah, I think it's it's to be determined. The way I look at it is this: if vaccines weren't working against the variants, and variants can change down the road, but our current variants, the ones that we're worried about, like the UK variant, you would start to see a rise in cases in vaccinated individuals, right? We're seeing a rise in cases, but that rise in cases is in unvaccinated individuals, and the variants are more aggressive. So that's why we're seeing a rise in cases in the unvaccinated. But the fact that you look at the statistics and the case rates going down in folks that are vaccinated and the death rates going down in those that are vaccinated, that to me gives you the insight that this particular vaccine at this particular time is effective against the current variants.
How much longer will COVID be around? Somebody's very fatigued on the other end of that question.
Yeah, I wish we could say it'll end, in May, or it'll end in June. I think you have to look at your controlled environments and your uncontrolled environments, and the general population is uncontrolled. You have varying mandates in varying states. You have varying opinions in varying states. So I can't answer that question with regards to the United States as a whole, but I can answer that question with regards to senior living communities. I think you're going to see a very timely end to the pandemic in senior living, given the prevalence of the vaccine. Doesn't mean we might not need boosters down the road, and we'll follow the CDC recommendations closely. But as I stated before, there's two different pandemics. There's the world pandemic, and then there's the controlled pandemic in senior living. And I think you're going to see that coming to an end currently, and hopefully the world pandemic will be coming to an end at the close of the year.
We can only hope, right? I think that was a great question to end on, and I really appreciate everybody's participation today. It's 1 hour never quite seems like enough, but I think that it was just enough to be easily digestible, and maybe we can do another version of this down the line in the not so distant future. But I didn't want to end today's discussion without giving everyone an opportunity for some final remarks if they have them, or comments before we close out. So Leland, you're the newbie to the panel, so let's start with you.
The only takeaway that I can offer everyone is just making sure that any product that you purchase at the grocery store for disinfecting or anything like that, that you're reading that manufacturer label, that you're making sure that you're using that product properly and letting it dwell for the right amount of time to kill the virus. Washing your hands, utilizing hand sanitizer, doing all those things that seem simple, but most of us just don't do on a frequent basis. So just keep it up, keep hand washing, keep sanitizing, keep disinfecting, folks, and we'll get through it.
Dave?
Thank you.
All right. Well, I think it's been a fantastic conversation and discussion, and I would just say, as I indicated before, it's an evolving situation. We just had, I think, to Dr. Hopkins' point about controlled versus uncontrolled environments. I think some of the statistics and hopefully the updates that we provided lend a sense of comfort to individuals who are thinking about moving into senior living communities. They truly are an extremely safe environment, and we are ahead of the curve, I think, in many respects with regards to that safety aspect. And just actually last week, there was a lifting of restrictions for those people, residents in senior living communities in Delaware, that would go out to visit with family members and return. Used to be that individuals had to quarantine for 14 days, but now for individuals that have met the immunization requirements, they no longer have to quarantine. And I think we're going to see that continue, that easing up of restrictions continue in senior living environments as the safety factor increases.
Sharon?
I think most of all, I hope that people really who haven't been vaccinated consider why vaccinations do work. We always hear the horror stories, and there truly is adverse reactions to anything medically induced into your body. But overall, when you look at the pros and cons, you have to remember this went through a lot of testing. Just the fact that they're paused to look at the Johnson & Johnson vaccine shows you that people are truly taking it seriously and aren't rushing. And I just want people to really, who have concerns, talk to your healthcare specialist. Look at the statistics that talk about it as a whole and not that one horror story you might hear. Because if people don't keep moving forward through vaccination, the positive that we're seeing in our controlled environment might not get out into the public.
Very well said. Rita?
Just that for our Vantage Point communities and all of us in particular who are sitting here on this panel, we will always do what is the right thing and try to stay on top of technology as it changes, and to offer all of the people who work with us and the people who live with us, the best lifestyle that they can possibly have, so that they don't have fear, so that they can stay safe, and they could live a long, quality-filled life.
Dr. Hopkins, you're last.
All right. Well, just to echo Karen's point, get vaccinated, and then it's safe. And I'm vaccinated. My wife is vaccinated. My parents are vaccinated, and but also consider, we have the luxury of dealing with folks that are in senior living. There's a lot of elders out there that are alone and isolated in their home, and they're scared. And if you know of anybody on your street or any neighbor that you think might benefit from getting the vaccine but can't get to the vaccine, lend them a hand, because they're the ones that are the most vulnerable. They're the ones that are most at risk, and they need the able more than ever right now. So don't just think about yourself. Think about the grandma or grandpa that might be at home, scared and alone, and lend them a hand to help them get vaccinated and maybe reduce some of their fear and allow them to live a normal life as well.
Really, really good point. I think I thank you all for spending this time with us. And if you have any questions following today in our discussion, please let us know. But otherwise, it was a pleasure, everybody. I hope we can do it again soon, and things will be even more on a positive track than they are today. So we appreciate it. Thank you for your time.